OpenStax Psychology, 2nd edition, Chapter 4, States of Consciousness, narrated by Dr. Nani Asman, University of Hawaii, Maui College, for Psychology 100, Survey of Psychology. I have often used the terms consciousness and wakefulness interchangeably, but if I really were to look at them from a scientific perspective, consciousness just is the awareness of internal and external stimuli, whereas wakefulness is a high levels of sensory awareness, thought, and behavior. So as long as I am aware, then I am conscious. But for me to be wakeful, I need to be rather aware, if that makes any sense. Our bodies have biological rhythms. A biological rhythm is an internal cycle of biological activity, which includes fluctuation of body temperature. Did you know that your temperature drops just before you fall asleep? An individual's menstrual cycle, that's more of a monthly thing. Level of alertness, there's some people who are very alert in the morning and are what we would consider larks. And others of us that are much more aware late at night, and that makes us night owls. They did find that most people tend to be aware around 4 p.m. regardless of their particular circadian rhythm. Now, a circadian rhythm is your biological rhythm that occurs over approximately 24 hours, which of course coincides with the rotation of the Earth on its axis. It's generated by the suprachiasmatic nucleus, and our sleep-wake cycle, which is one of our main circadian rhythms, is linked to our environment's natural light-dark cycle. So what controls our biological rhythms? The hypothalamus is responsible for maintaining homeostasis, the tendency to maintain a balance or optimal level within a biological system. Relatively succinct throughout. This chart just shows how our circadian rhythm changes our body temperature over a 28-hour period. This was for 8 young men, and you'll notice the body temperature rises throughout the day, usually kind of peaks in the afternoon, and then falls during sleep, with the lowest point occurring during the very early morning hours. The suprachiasmatic nucleus, or SCN, is located in your hypothalamus, and it serves as your brain's clock, basically. The clock sets itself with light information received through projections from the retina, allowing it to synchronize with the outside world. Our sleep-wake cycle is also regulated by other factors like the hormone melatonin. Melatonin release is stimulated by darkness, making us sleepy, and it's inhibited by daylight. So if you're having trouble falling asleep at night, you might want to start turning down the lights and not looking directly at a lit screen right before you need to go to bed. Actually, probably an hour or so before you have to go to bed. Melatonin is released by your pineal gland. And your sleep regulation is the brain's control of switching between sleep and wakefulness, as well as coordinating the cycle with the outside world. Each person has an individual circadian pattern of activity known as a person's chronotype. If you've ever pulled an all-nighter, flown somewhere, had jet lag, or worked a rotating shift, you know that can throw off your sleep cycle. Jet lag is fatigue, sluggishness, irritability, and insomnia, usually resulting from a mismatch between our internal circadian rhythm and our environment. If you were in California and were to fly east to Florida, it would then be 3 hours later than you are used to. which would make it more difficult for you to fall asleep because your normal bedtime of, let's say, 10 p.m. in California, when you're in Florida, 10 p.m. in Florida would only be 7 p.m. in California, which would make it a lot harder to fall asleep early. On the other hand, if you were in California and flew west to Hawaii, we would be 2 or 3 hours earlier, and it's usually easier to adjust to the time zone because people find it easier to stay up late or stay up a little longer than they do find it themselves able to fall asleep early. Your rotating work shift or work schedule, if it changes from early to late on a daily or weekly basis, it'll make it difficult for you to maintain your normal circadian rhythms. And that can result in feeling exhausted, agitated, having difficulty sleeping, and can lead to signs of depression and anxiety. One thing they've noticed is bright light can be used to realign our biological clocks with the external environment. So for example, one of the ways to get around jet lag, they say, is to make sure that you are awake for both sunrise and sunset, and you go outside and you watch it. Similarly, with the rotating shift work, if you need to be awake and it's late at night, turn on a lot of lights. That will trick your body into thinking that it's daytime. Sleep deprivation or sleep debt is a result of chronic insufficient sleep. When you miss too much sleep, you go into what is called a sleep rebound, where it'll take you a lot shorter time to fall asleep the next time you have the opportunity to fall asleep. Oftentimes it's not an opportunity you should necessarily have, like, sitting in class when you have stayed up all night gaming or studying or working. Here's a chart that shows you the recommended hours of sleep by age. I think the easiest thing to notice is that the older you get, the fewer hours of sleep you need. A baby needs 14 to 17 hours of sleep a day, usually in 2 to 3 hour increments, whereas the young adult needs roughly 7 to 9 hours, which doesn't change too much through adulthood until you become over 65, and then you can usually get away with 7 to 8 hours. You will also see in this chart what could still be considered appropriate hours of sleep, which usually has a larger span compared to the recommended hours. And you'll also see the column of not recommended. You don't want fewer than a certain number of hours or more than a certain number of hours. So what is sleep? It's a state with relatively low physical activity for most people and a reduced sense of awareness. The sleep-wake cycles seem to be controlled by multiple brain areas, including the thalamus and the hypothalamus and the pons. Sleep is associated with the secretion of and regulation of many hormones, including melatonin, which we've talked about before, follicle-stimulating hormone, luteinizing hormone, and the growth hormone. Here are the areas of the brain involved in sleep. Why do we sleep? We used to think that it was an adaptive function or some sort of evolutionary hypotheses. We believed that sleep was essential to restore resources that are expended during the day, and that sleep was an adaptive response to predatory risks, which increase in darkness. There is little evidence, however, to support these explanations. Our cognitive function focuses on sleep's importance for cognitive function and memory formation. Research shows that sleep deprivation results in disruption in cognition and memory deficits. These impairments become more severe as the amount of sleep deprivation increases. and slow wave sleep appears to be essential for effective memory formation. So benefits of sleep: maintaining a healthy weight, lowering stress level, improving mood, increased motor coordination, as well as many benefits related to cognition and memory formation. You can also think of it as, if you have sleep deprivation, you could end up being an unhealthy weight, you will be more stressed, you will probably be grumpy, you might be more clumsy, and you might have a greater difficulty thinking or remembering things. Using an EEG, they can measure our brain wave activities and see how it changes during the different stages of sleep. If you are wide awake, like I hope everyone is listening to this video, your brain would be giving off beta waves. If you are starting to fall asleep, you're just maybe starting to nod off, you begin alpha waves, which are relatively low frequency, relatively high amplitude, and synchronized. As you fall deeper asleep, it goes from alpha to theta waves. Theta waves are also low frequency and low amplitude. Once you fall into a deep sleep, those would be delta waves, low frequency, high amplitude, and desynchronized. It's kind of all over the clock there. So stage 1 sleep is that transitional phase between being awake and being asleep. During this stage, the rates of respiration and heartbeat slow down. Your overall muscle tension and core body temperature decrease. And as I said in the last slide, your brain gives off alpha waves. After about 10 minutes or so in stage 1 sleep, assuming a normal sleep cycle, your body would go into stage 2, where the body goes into deeper relaxation and starts to give off theta waves, which are characterized by the appearance of both sleep spindles and K complexes as seen in the graph on the slide. A sleep spindle is a rapid burst of high-frequency brainwaves, whereas K complexes are a very high amplitude pattern of brain activity. When my child was little and I was trying to put her to sleep, I realized that if I waited a little longer and held her a little longer so that she moved into stage 2 sleep, which was a deeper sleep, I was more likely to be successful at putting her down without waking her up. Stages 3 and 4 of sleep are known as slow wave sleep. In stages 3 and 4, your brain gives off delta waves, and your respiration and heart rate slow down even further. Another sleep stage, one is that is not normally numbered, is rapid eye movement, or REM sleep. It's called this because during the stage, your eyes make some very rapid movements. You might have seen someone sleeping before, and it looks like their eyes are twitching back and forth underneath their eyelids. That's rapid eye movement. During REM sleep, you have a paralysis of voluntary muscles. You tend to have a lot of dreams, although you can have dreams in stage 4 also. And your brain waves are similar to those seen during wakefulness. REM sleep is often referred to as paradoxical sleep. And the paradox is that our brains seem to be nearly awake by brainwave patterns, but our bodies are paralyzed. If you have ever heard of or experienced something in Hawaii that is called pressing, it's supposed to be the idea that a ghost is sitting on your chest, making it difficult for you to breathe. While I can't prove or disprove that statement, what I can say is that if someone is awoken from rapid eye movement sleep quite abruptly, their brain, doesn't take very long to get awake since it was kind of in a wakeful state already. But the paralysis of the voluntary muscles might take a little longer to wear off, and so during that moment where your brain is awake but you still feel paralyzed, one could feel like something is sitting on one's chest, making it difficult to breathe. This is a hypnogram of an example of sleep stages. A hypnogram is a diagram of stages of sleep as they occur during a period of sleep. And this shows how an individual moves through the various stages of sleep. Oftentimes it starts out awake, drops down to stage 1, 2, 3, usually kind of bounces back up again to 2, 1, maybe you hit REM, back down to 2, 3 again, back up again into REM, perhaps you wake up a little bit, back down to stage 2, stage 3, and eventually you're going to go into stage 4, which would be a very sound state of sleep. There are quite a few different theories about dreams. Any dream that talks about a hidden meaning is technically a Freudian interpretation of a dream. Freud saw dreams as a way to gain access to the unconscious. The manifest content would be the actual content of your dream, so that'd be like the storyline or plot of your dream. Whereas a latent content would be trying to decipher the hidden meaning. So the manifest content could be something like you're being chased down the street by a bag of Doritos, whereas a latent content could be something to the effect of you have been attempting to eat a lower carb diet in an effort to be healthier, and the Doritos chasing you down the street is maybe some sort of symbol of how your unhealthy eating habits are trying to take over again. Carl Jung believed that dreams allowed us to tap into our collective unconscious. The collective unconscious is a theoretical repository of information shared by all people across cultures. In other words, we all share the same unconsciousness. He believed that certain symbols in dreams reflected universal archetypes, and we'll talk about that more in the personality chapter. There's also some research that shows that dreams may represent life events that are important to the dreamer. There's also a theory that talks about dreaming as a way to show a state of proto-consciousness or virtual reality in the mind that helps a person during consciousness. There have been a few movies out about lucid dreaming, and there's definitely a bunch of books about that out there, where certain aspects of wakefulness are maintained during a dreaming state, and you can become aware that you are dreaming. I can't really direct my dreams personally, except for the fact that sometimes if something is going wrong, I can tell myself that it is just a dream, and I can actually wake up, which is kind of cool. And probably the dream theory that most psychologists like is what we call the activation synthesis model. And that basically just says that your brain has some random neural firing while you are sleeping, and your mind tries to make sense of this randomness, and that is what becomes your dream. Now we're going to talk about some sleep disorders. Insomnia actually has two different kinds. It's defined by either difficulty falling asleep, or maybe you can fall asleep quite easily, but you have difficulty staying asleep for at least 3 nights a week for at least 1 month's time. This is probably the most common sleep disorder, and it could be associated with symptoms of depression. It could also be associated with stress from maybe work or school, or having a new baby or a puppy or a kitten. Those things can all contribute to insomnia, as can age, drug use, exercise, mental status, and bedtime routines. Those with routines are less likely to have insomnia than those without routines. Treatment oftentimes has to do with stress management techniques, because if you're too stressed and that's what's keeping you awake, you need to learn how to lower that stress. Changes in problematic behavior could also contribute to insomnia. And also cognitive behavioral therapy, which focuses on cognitive processes and problem behaviors, can help you with your insomnia because it gets rid of the problematic behaviors. Parasomnia has to do with unwanted motor behavior or experiences throughout the sleep cycle. They include sleepwalking, whose fancy term is somnambulism, somnabulism. Somnambulism just means sleepwalking. It's actually not true that you could kill someone if you wake them up while they are sleepwalking. Sleepwalking does tend to happen in stage 4 of the stage 4 sleep cycle, and so it's just that it can be difficult to awake someone when they're in that deep a state of sleep. And you don't have to just sleepwalk. I've had students who sleep furniture moved. That student thought for sure that his buddies were messing with him every time he went to sleep, and they would come in and rearrange his room. They, of course, insisted they weren't doing that, but of course it kept happening. And then one day my student woke up and the dresser was blocking the door, which opened inwards, and so there was absolutely no way that someone could have set that dresser in that position unless they were still inside the room. I had another student who used to sleep sandwich make. His mom was getting really upset because someone was coming down in the middle of the night making a sandwich, but then leaving the refrigerator open and all of the sandwich parts out on the counter. Mom didn't mind someone making a sandwich late at night. She just wanted them to clean up after themselves and put everything away. So she hid out in the kitchen one night in the dark until she saw my student come down the stairs, open the fridge, make a sandwich, start to eat the sandwich, and then as my student was leaving the kitchen, Mom finally tried to say something, at which point she realized that her kid was actually asleep and sleep sandwich making. The REM sleep behavior disorder obviously happens during REM sleep, and it occurs when the muscle paralysis that's supposed to happen during a REM sleep doesn't happen. So you end up with high levels of activity during REM sleep. I have known people who twitch so much, I believe that's called nocturnal myoclonus, but they twitched so much that they would actually throw the other person, their partner, out of bed because they twitched so violently. There's also restless leg syndrome. This happens when you have uncomfortable sensations in your legs while you're trying to fall asleep. That's relieved by moving the legs, and so you have, you're kind of twitching back and forth, moving back and forth with these restless legs. They can be treated by a variety of medications. A lot of times it's a sign that you're low in potassium, so all you have to do is maybe eat a couple more bananas a day. Some people suffer from night terrors. Now, night terrors are very different from nightmares. Everyone has nightmares. Those are just bad dreams, meaning the content of the dream you are having kind of stinks, bums you out, scares you, something like that. A night terror, on the other hand, has the sleeper experiencing a sense of panic where they might actually scream or physically attempt to escape. Tends to occur during non-REM sleep, a lot of times during stage 4, so it's a very deep sleep. I had a friend in grad school once who she was going to take me to the hospital the next morning for surgery, so I spent the night at her house, and being the very kind person that she was, she gave me the bed to sleep in, and she had to tell me about the fact that she had night terrors, and it was a good thing she did, because in the middle of the night she was kind of screaming and crouching in a corner trying to protect herself, and I had to very gently keep saying her name over and over again to wake her up and to reassure her that everything was okay. Sleep apnea happens when the person stops breathing during their sleep, usually for 10 to 20 seconds or longer. Basically, sleep apnea is a fancy words for very bad snoring. This leads to repeated disruptions in sleep, and leads to increased levels of fatigue. It is often common in people that are overweight, although I have known people who are not overweight who have suffered from sleep apnea. If you have obstructive sleep apnea, what it is that the airway becomes blocked and air is prevented from entering the lungs. This tends to happen in people who are overweight because all of the tissue around the throat ends up blocking the airway while you're sleeping. For some people, when it's a central sleep apnea, it's because your central nervous system is failing to initiate breaths. Treatment tends to include a continuous positive airway pressure, or CPAP device, which actually pumps pressurized air into your airways. Sudden infant death syndrome, or SIDS, occurs when an infant stops breathing during sleep and dies. It's most likely to happen in infants younger than 12 months old. They're the ones who are at the highest risk. For some reason, boys seem to have a greater risk than girls, but this is a correlation. So all we've done is notice that boys die from SIDS more than girls do. Contributing factors tends to be premature birth, smoking within the home, and hyperthermia, being way, way, way too cold. My kid was born over 2 months premature. I'll tell you more of that story in the development chapter. But she was in the neonatal intensive care unit, or the NICU, for almost 2 months because the axons in the part of the brain that controlled breathing, so in the brainstem, were not properly myelinated because she came out early. So that myelination, the myelin growing around those axons, should happen in the last couple months of pregnancy, which did not happen for my child. And so she kept doing what the doctors called spontaneous breathing. I called it spontaneous not breathing because most of the time she was breathing just fine. But then every once in a while she would just stop. And when that happened, all the alarms would go off in the NICU tied to her incubator or crib. And all you really had to do was just kind of touch her back or touch her foot to stimulate her, and she would start breathing again. But it was very stressful to have happen the very first time. And the look on every parent's face the first time it happened was just about the same. Narcolepsy involves an irresistible urge to fall asleep during waking hours. It's often triggered by states of heightened arousal or stress, and shares many features of REM sleep, including cataplexy, the loss of muscle tone while awake, or in some cases, complete paralysis of the voluntary muscles. You also oftentimes have hypnagogic hallucinations, which are vivid dreamlike hallucinations. Treatment seems to be the prescription of psychomotor stimulant drugs. If you watch Supergirl, the dreamer, Nia's character, suffers from what appears to be narcolepsy, but really she's just accessing her superpower, which really has no standing in this class. It just seemed like a good story to tell. Now we're going to move on to substance abuse, or I should say substance use and abuse. So substance use disorders are compulsive patterns of drug use despite negative consequences, according to our DSM-5, the Diagnostic and Statistical Manual, 5th edition, what we like to call in my house the big book of psychological boo-boos. If you've watched Doc McStuffins, you recognize that reference. All right, there are two kinds of dependence: physiological dependence and psychological dependence. If you've been taking a drug for a long time, your body will literally get used to having that chemical in your system. So you are physiologically dependent because lack of that drug will lead you into having withdrawal symptoms. There on the bottom of the page. Withdrawal is negative symptoms experienced when drug use is discontinued. Now, some people develop what's called a psychological dependence, meaning it's an emotional need for the drug. Maybe you need to drink a lot of alcohol because you don't know how to relax otherwise. Or maybe you have difficulty sleeping, so you start taking an over-the-counter sleep aid, which generally tends to be just Benadryl, the antihistamine, but it does make you sleepy. In those cases, Benadryl is not habit forming, so you won't become physiologically dependent. But if the only way you know how to fall asleep is to take a pill, then it is possible that you will become psychologically dependent, because you can't fall asleep without taking your pill. Tolerance is what happens when a person requires more and more of a drug to achieve the effects previously experienced at lower doses. This is linked to a physiological dependence. So if you are physiologically dependent on a drug, you will need more of it to basically feel high or whatever feeling you're going for. For example, for those of you over the age of 21, because of course no one in here has ever had any alcohol under the age of 21. So the first time you had a beer and you're 21, maybe just one beer made you totally drunk and loopy. Maybe after drinking for a few years, and I'm not saying drinking a lot, but just drinking, somewhat regularly, once or twice a week, pretty much every week, and in reasonable amounts, you will develop a tolerance, and so one beer, you might not feel those effects as much. Now, I do want to point out that just because you don't feel tipsy or drunk doesn't mean that your reflexes agree with you. They did a study in Germany where people coming into a cocktail party had to first sit down and do a driving simulation. And so while they're driving, a ball pops out from the side of the street, and you have to slam on your brakes to avoid hitting the ball. Then they had people go into the cocktail party and have one cocktail. Usually it was like a glass of wine or a beer. And then they would come back out. Most people would say they didn't even feel intoxicated, tipsy, nothing. They said they felt nothing. But when they did the driving simulation again, a lot of times their reflexes slowed by like 5 seconds, which you might not think is all that much, but it can be the difference between hitting someone or something and not hitting someone or something. So here's a little public service announcement: don't drink and drive, ever. There are 4 main categories of drugs: stimulants, depressants, hallucinogens, and antipsychotics. We'll talk about them today in this presentation. Here's a chart that shows you the different kinds of drugs, examples of the drug, the effects they have on your body, the effects when used, and the fact that they are all psychologically addicting. A depressant or a downer is any drug that suppresses your central nervous system activity. They're usually GABA agonists, which have a quieting effect on the brain. They work by binding to GABA receptors, which make the neuron less likely to fire. These examples of this kind of drug are alcohol, barbiturates, which would be anticonvulsant medication, and benzodiazepines, which tend to be anti-anxiety medications. The anti-anxiety medications you get to people who have very severe panic attacks. This is Valium, Xanax, you've probably heard of. We'll talk about these a lot more in the last chapter of the book on treatments and therapies. Alcohol, again, is an example of a depressant. It's probably the most popular or most commonly used depressant. Like I said earlier, it decreases reaction time and visual acuity. It lowers your level of alertness. It reduces behavioral control, and it can result in complete loss of consciousness. If you end up drinking way too much alcohol, you can end up with acute alcohol poisoning, which will result in you needing to get your stomach pumped. Otherwise, you could actually die. Here is an image of a GABA receptor, and you can see what's happening with the different, the neurotransmitter or the different examples of medications. Stimulants or uppers or any medication that increases overall levels of neural activity. Usually dopamine agonists, which work by preventing the reuptake of dopamine. Dopamine activity is associated with reward and craving, so these drugs can be highly addictive. These include cocaine, amphetamines, cathinones, MDMA. The side effects of stimulants can include nausea, elevated blood pressure, increased heart rate, feelings of anxiety, hallucinations, and paranoia. Now, some people think that something like MDMA, which is ecstasy or Molly, isn't very dangerous, that it's a mild stimulant. And maybe if it was pure MDMA, that would be true. But a lot of times, drug dealers mix in other things because, you know, it's cheaper to do it that way. And one of the things they mix in is rat poison, which interestingly also gives you similar hallucinogenic reactions. The thing is, though, the way that rat poison works is that it stops your body from clotting. And so if you have taken some MDMA that has a decent amount of rat poison in it, you could be, you know, excitedly dancing on a table, fall over because, well, you know, your blood pressure is really high and your heart rate's really high. And then you end up hurting yourself and you end up with internal bleeding, and you actually could die from bleeding internally. This is just a picture showing you an example of dopamine agonists as they block the reuptake of dopamine from the synapse into the presynaptic cell. Now, nicotine and caffeine are also stimulants. They are, well, caffeine's a legal stimulant. Nicotine is legal if you're over the age of 18. Caffeine involves antagonizing the adenosine activity. It increases your levels of alertness and arousal. If you have not gotten enough sleep and are in sleep debt or sleep deprivation, a lot of people, the habit is to have a cup of coffee or 2 or 3, which essentially makes you chemically awake. Now, nicotine interacts with the acetylcholine receptors. It is highly addictive, and it plays a role in arousal and reward mechanisms. Nicotine is a stimulant. I'm going to say that one again. A lot of people think that it's a depressant because you see someone who is addicted to nicotine who maybe can't smoke a cigarette because they're stuck indoors at work and they're starting to get very, very agitated. What you're actually witnessing there is withdrawal from nicotine, which gives the person the agitated behaviors. And so when you see them finally able to smoke their cigarette or vape, what you're seeing is the relief of those withdrawal symptoms. But chemically, nicotine is a stimulant, and it's going to, you know, increase the CNS activity. Opioids are a kind of depressant. They serve as analgesics, which decrease pain through their effects on the endogenous opioid neurotransmitter system. They are highly addictive. We talked about morphine already back in the biopsychology chapter and how it is an agonist for endorphins. There has been an opioid crisis lately where people are getting addicted to originally a lot of times prescription medication, pain medication following a car accident or something, or some sort of pain situation. and then they keep taking the opioids when they no longer have pain, which leads to the addiction. Now, chemically, if you are taking an opioid correctly for pain, it's supposed to be that you can't get addicted because it's just making up for the lack of endorphins. Whereas if you take opioids when there isn't pain, you can get addicted. That is not to say that you don't get used to taking the opioid if you suffer from some sort of chronic pain issue. Hallucinogens cause changes in your sensory and perceptual experiences. In other words, you see or hear or taste or smell or feel things that are not actually there. They can involve some vivid hallucinations. They vary with regards to the specific neurotransmitter system they affect. Mescaline and LSD are serotonin agonists. PCP and ketamine are NMDA glutamate receptor antagonists. And of course, there's variability, I should say, within the different types of drugs as well. Medical marijuana shops are becoming more and more common in the U.S., and there are some states that have actually legalized marijuana, saying that it is no different from alcohol, although there are lots of people who like to debate that belief. Another altered state of consciousness is hypnosis. Hypnosis is an extreme focus on the self that involves suggested changes of behavior and experience. Clinicians could use relaxation and suggestion in an attempt to alter the thoughts and perceptions of a patient. It has been used to draw out some information believed to be buried in someone's memory. We've talked about how that may or may not always happen accurately. Unlike what you see in the media, individuals undergoing hypnosis are in control of their behavior, because it's important to know that you cannot do something while hypnotized that you would not be willing to do awake. Now, there are some people who, they'll cluck like a chicken or dance all crazy on the stage. Maybe you saw that during grad night. And maybe this is a person who is usually kind of reserved. They are basically were willing to get up and do those things, probably using the I was hypnotized kind of as their explanation or excuse as to why they were doing that behavior when they normally wouldn't. People vary in their ability to be hypnotized. If this were a face-to-face class, I might actually try to hypnotize you. And I would see that when some people would be very susceptible to it, and others will be very resistant to it. Hypnosis can be used to help pain management, treatment of depression and anxiety, quitting smoking, and weight loss. The trick is you have to believe that hypnosis will work. If you think that using hypnosis will help you quit smoking, then using hypnosis can help you quit smoking. But if your mom signed you up for hypnosis to quit smoking and you don't want to quit smoking, it's not going to work. Meditation is another altered state of consciousness. Some people say it's similar to a kind of self-hypnosis. You're focus on a single target like breathing or a repeated sound to increase your awareness of the moment. You tend to be relaxed yet focused and very aware, and it shows promise in stress management, sleep quality, pain management, and treatment of mood and anxiety disorders. But similar to hypnosis, you have to be willing to meditate and be willing to try these techniques out to help you with these different kinds of issues.